type 2 diabetic. Now, a lot of times when you are living with diabetes, just the simple management or being able to keep up with the management and blood sugars and A1Cs and your cholesterol can sometimes get very overwhelming for a diabetic, so much so that they develop a tunnel vision. In other words, they're just really just focused on their diabetes, trying to avoid complications, keeping up with their physician appointments, and there's a tendency to overlook the entire body. Yes, diabetes does affect your entire body, but there are certainly other things to maintain your body, and that's where preventive health comes in. Now, I invite you to go over to my main site, askdrno.com/blog. That will be at the end of this video, or just click on the tab that says Ask Dr. No on the website, and it'll take you to the video blog I did earlier on this week on women's health updates. So if you're a woman living with type 2 diabetes, I encourage you to watch that video blog also, because I won't be repeating the recommendations that I will be that I put in there. I won't be repeating them here. So very important. Let's go into some of the preventive health guidelines or recommendations that you should be aware of and also discuss with your physician. The first and foremost is dental checkups. Dental checkups. Make sure you maintain at least twice a year a visit to your dentist. Why? Because dental disease, independent of being diabetic, has actually been found to increase your risk for heart disease. Now, as I may have shared with you in an initial blog or in my upcoming book, being a diabetic puts you at twice the risk for heart disease. So, let's do the math. If dental disease alone puts your risk for heart disease and you also have diabetes, then you're kind of quadrupling your risk. You're really increasing your risk. So make it a commitment to visit your dentist twice a year, have routine, regular dental checkups, but more importantly, every day floss your teeth. I know you brush your teeth, but every day floss in between your teeth. That will go a long way to reducing your risk for dental disease, gum disease, loss of teeth. As you get older, this can be very, very debilitating, and it's already a challenge to maintain a healthy diet, speak less of not being able to digest or chew the food well enough to swallow. So these simple things that sound very common sense can become very, very expensive as you get older, because let's face it, dentures are very expensive, and even if you wanted to take it a step up and go to dental implants, those are still very expensive. So an ounce of prevention, right, is worth a pound of cure. All right, so the next preventive health that I'm going to talk about, and I mentioned briefly in the Women's Health Update, is if you are over the age of 50, to ensure that you have a regular colonoscopy starting at the age of 50. Yes, the risk for colon cancer does begin to increase probably over the age of 40 and pretty much by 50. And the current screening guidelines are to make sure you're screened every 10 years. Some authorities are recommending screening every 5 years, especially if you've had evidence of a polyp. So your digestive health is very important. Maintaining regular bowel movements, making sure you maintain increased fruits and vegetables to improve that, maintain your antioxidant levels. These all go a long way, especially maintaining your fiber for a type 2 diabetic. Maintaining your fiber intake to over 40 grams, preferably between 35 and 40 grams of fiber every single day, goes a long way to improving not only your digestive health, but also preventing the highs and lows of your blood sugar, so your blood sugars are more evenly maintained. Okay, let's move on for men. If you're a man over the age of 40, especially an African American man, please begin to have your annual prostate check. Now, I know you're going to roll your eyes at me, and you can do that all you want, but the incidence of prostate cancer is increasing, especially in our African American population. I can't tell you how many people between, the age of 40 to 50 in their 40s are being diagnosed with aggressive prostate cancer that can be very debilitating. So something to really pay attention to, just get your annual prostate check and get a PSA, okay? So those are some of the guidelines that I strongly recommend. Now, let's go on to, I did mention osteoporosis screening for women over the age of 65. So again, that's in my women's health updates on my main site. But let's go on to examining immunizations. Now, immunizations become very important for type 2 diabetic. The main immunization that I want to focus on, actually I want to focus on several, but the main one is your pneumococcal vaccine, your vaccine that protects against strep pneumonia. Now, a lot of people are under the misguided impression that if they have a pneumonia vaccine, that they will not have pneumonia. No, there's just a type of pneumonia called strep pneumonia that actually has a very high incidence of death that this pneumococcal vaccine protects against. And we usually recommend that for our diabetics, our type 2 diabetics over the age of 55. So please consult with your primary care physician about getting a pneumococcal vaccine if you already have not. Now, another vaccine that you may have heard about is your tetanus, diphtheria, pertussis. It's called Tdap, Tdap. This protects you against three diseases: tetanus, diphtheria, and pertussis. Pertussis is the whooping cough. We usually recommend getting a booster at the age of 50 of the Tdap, and then every 10 years thereafter you get a boost of the TD, which is just a tetanus, diphtheria. So again, if you have not already had this and you're over the age of 50, consult with your primary care physician. Again, open sores, which diabetics may have an increased risk of. I'm not saying you do 100%, but yes, you do have an increased risk of open sores, and you do not want that to be an entry point for tetanus, okay? So the next vaccine we're going to talk about is the vaccine that protects against zoster, herpes zoster. And this is a vaccine that we usually recommend over the age of 65. And that's because zoster, herpes zoster, which causes shingles, can be very debilitating. Already as a type 2 diabetic, diabetes tends to affect your nervous system. You tend to have what we call neuropathy, nerves that do not function very well. And if you were to get shingles on top of a sickening nervous system, that can be very debilitating. I cannot tell you how many people I've seen affected by herpes zoster, in which they have this chronic burning pain even after the shingles lesions have healed. And we do all we can to help control the pain, and their lives, the quality of their lives really changes. So again, go ahead and consult with your physician about getting a herpes zoster vaccine. It's called Zostavax. So those are the vaccines that I want you to really pay attention to. Of course, depending upon your individual circumstance. For instance, if you're a dialysis patient, then your physician may recommend you getting a hepatitis B vaccine, in order to protect you from bloodborne diseases. So that's, again, an individual, something that you discuss with your physician on an individual basis. So that's, in a nutshell, some of the things I highly recommend that a diabetic, has every year. Discuss this every year. Schedule a separate annual physical exam. Don't make it part of your routine care, because what tends to happen again is on the part of your primary care provider, they too may just have tunnel vision. They too may just, feel, okay, you're just here to pay attention to your diabetes, and then, things get lost in translation. Let's face it, we're all human. So schedule one separate visit every year to look at your entire self. Now, speaking of that, one of the things that your physician may want to screen you for is depression. Now, I know that may be equivalent to a four-letter word for some of you, but let's begin the conversation about depression. Being diagnosed with a chronic illness can be overwhelming, as I said, for some people. Some people shut down, don't want to address it. And what better time than during your annual physical to be screened for depression? It's a very simple test that your physician can carry out. It's a questionnaire that you're given. And you can even obtain the questionnaire, and I'll make sure that I obtain a link attached to this video blog that you can actually print out and probably take to your physician and see for yourself whether you do have any symptoms that put you at risk for depression. A lot of times you don't necessarily have to start medications, but sometimes just being able to speak about your challenges, speak about the problems you're encountering, speak about the frustrations when your blood sugars are all over the place and you seem to be doing everything you can. And that again is where roles like health coaching, which is what I offer, come in. Being able to have an open dialogue, being able to be supported, create that extremely supportive system that enables you to stay on track without getting overwhelmed. So again, once again, think about being screened for depression. Now, here's some things that I recommend that you do every day. And this is my pet peeve. Every day for your preventive health, for your health maintenance, make sure you dry in between your toes. Yes, every 3 months, your physician should be looking in between your toes and also carrying out what we call a fine filament test to make sure that you do not have any evidence of early neuropathy, which is where the feet, you no longer are able to feel sensations in your feet. But in between your toes is a fungus that could grow if there's a lot of moisture, and that is athlete's foot. And athlete's foot is one of the main reasons, the first entry point possible for diabetic foot infection. And so in order to prevent that, simple, dry in between your toes every single day. And if you tend to wear, boots or stuff that really keeps the moisture in, think about using a foot powder. Some very common sense things, but things to pay attention to. So I hope this has been able to provide you with enough information about some preventive health guidelines, keeping you on track. It shouldn't really add too much. I do strongly recommend that you partner with a family member or a friend to keep you on track, and keep a checklist. And I will also be sure to publish a checklist sometime later on the website. Until next week, have a powerful week, everybody. And if you have any questions or comments or suggestions for upcoming topics, feel free to leave a comment below. Have a great day. Be well. Goodbye.